Anneysa, you know, with Apollo Total Health, your mission is sort of womb to tomb, in a sense. So if sort of someone lives for about 80 years, we're talking about 4,000 weeks of life.
Correct.
So, you know, every second and almost every day counts, because when you bring your life down to an idea of 4,000 weeks, suddenly everything becomes really important. So when your mission is womb to tomb, where are the areas that the focus is on?
We look at an upstream approach when we talk about healthcare, and we make sure that we break the dichotomy between social well-being, institutional delivery, as well as the healthcare systems. One thing we have realized that it's good to have interventions and initiatives, but if you're not complementing the government schemes, how far can you go? Our entire policy is such that the womb to tomb comes from first starting with a health camp. So early detection, let's understand, let's screen that village that we adopt. Our chairperson, Dr. Pratap C. Reddy's, very, very close to his heart is a place called Aragonda, very close to Tirupati. We have now explored about 5 different geographies, but if you go into Aragonda right now, we have practically screened every single person. And that health data helps us to come up with a very good data-driven interventions. And we look into both your NCDs, non-communicable diseases, and seasonal flus. And because you have the data, it's so much easier for us to set up the war rooms.
Yeah, sort of health. We were discussing how it's so important to sort of inculcate that from a very young age, because obviously the earlier you begin, the healthier you're going to be. And we were seeing pictures from Aragonda and from the Hygiene Park. So I'm first going to just come back to you, Anneysa. So, you know, you looking at like total health from when they're children all the way. So when it comes to this park, what was like, did you have in mind when Apollo like set this up? What was like really like the aim?
We look at Hygiene with Reckitt as a collaboration for total health. And one thing we realized, COVID also made children have a lot of social anxiety. Today, when you bring children to a park, they are not collaborative anymore. They are shy, they are introverted. So if you have to open a park, it also meant give them an opportunity to collaborate. And this play park obviously has a lot of hygiene messages that the children are the advocate for the future. They take it back home, and the family are also educated through the children, but it also gives the child in the park to collaborate with each other. So that was number one that came to mind while designing. And second is, where do we pay the play park? Initially, we thought, oh, shall we put it next to a school? You know, they'll be secured and children use the school so much. Then we realized that a child might want to go to a park, but the parents are always busy. And we so easily just put the blame on the child and say, you know, they're always on their mobile phone. They are there because we are not able to give our children enough time these days. So we thought in rural India, day still starts in a temple and ends in a temple. So we strategically found this space which was between 2 temples which are used by everybody in Aragonda. And the parents now bring the child in there, they go to the temple, the child then comes, plays, and it's a holistic approach towards the child. And we have a lot of cute signages all over Aragonda. So the child is also nagging to the parent at the bus stop that I want to go to the play park right now. So we saw that, and that was very exciting. And of course, our chairperson was really gracious to give us that space and come up with this play park.